This video is the first in a series of Q&A videos. So recently I asked on Facebook for questions, and very kindly many of you submitted some questions. I think there's 22 questions and topic areas. So I'll probably do maybe three or even 4 videos to answer them all. The questions are very, very helpful, so please find me on Facebook and post a question, or just as a comment on any of my YouTube videos. I read every single comment. Yeah, so please share your questions, because really helps me a lot. So the first, it's 2 questions from my friend Eleanor. So the first question she asks is, of the plethora of complementary therapies, which do you think is worth pursuing? And the second question is, how do you persuade a newly diagnosed patient to explore outside of standard care? So they're kind of related questions, I think. So for the first one about complementary therapies, I don't think any of them is worth pursuing at all. I wouldn't spend even a second thinking about them. That's not because I think they certainly wouldn't work or anything like that. Some of them may, but with a limited amount of time and attention, and particularly money, it just doesn't make sense to spend even a second thinking about a complementary therapy. There are so many proven cancer treatments available for every kind of cancer. It just doesn't make sense. So I should kind of dig into that a bit, though, and in doing so, hopefully get towards answering the second part, or second question rather. So there are many cancer treatments that have been developed over many years. There are some new ones and there are many old ones, and some are in common use and some aren't. And some are in common use because they be found to be effective for a large percentage of patients, and the side effects are maybe manageable, and the price is right. There are also cancer treatments that work well, but the side effects are too severe for them to be like a standard treatment. There are cancer treatments that are approved for use in one country but not in another, and that may be because of cost or because of how the clinical trials were done, or that kind of thing. So there are so many cancer treatments to pursue, and a huge change that I've seen just in the past 8 years of dealing with cancer is that now, for late stage patients, so that's generally patients whose cancer has spread to a distant part of the body from where it started, it's now becoming more and more viable or practical to treat the cancer where it is, so using what are called local treatments instead of using systemic treatments. In the past, it made no sense to do that, because if cancer is spread around the body, you treat it in one part, all you're doing is subjecting the patient to a bunch of side effects and maybe immune system damage as well, and you're not doing anything to deal with a systemic spread of cancer. Now in 2024, it's a very different situation. One thing is that systemic treatments are now better. So that means maybe they can be used more gently or for longer periods of time, or they can be relied upon more. And we now have lots of local treatments that are much less damaging to the body. So, for example, radiotherapy, where the intensity of the radiation can be adjusted, or the beam can be shaped to match the tissue in a tumor, or heavy particle radiotherapy, which has this bizarre property of the beam actually starting in the tumor and ending abruptly at the edge of the tumor, so not damaging too much healthy tissue. So given that there are so many treatments available that are scientifically based and to some extent proven to work, possibly for a small percentage of patients, it just makes so much more sense to try and access those treatments. So if you're, let's say you have a certain type of cancer and there's a treatment that is not approved because in trials it produced remarkable results but only for a very small percentage of patients, and it's a treatment that's very expensive but not particularly damaging, well, if you can somehow access that, it sort of makes sense to try it, because if it's not too damaging and you may be lucky in that tiny subset of patients who get a really good response, the sort of, often I think treatments are sort of rejected on a basis of economics within a health system, and that's not relevant for us as an individual patient. So if you can access the treatment through some kind of trial or compassionate use from the drug company, or paying with private health insurance that you may have, or paying through crowdfunding like I do, it makes so much more sense. Also, there are all these treatments that are just becoming available, not approved yet, but it makes sense to try and get early access to some of those, whether again that's a trial or a case study or some other way. Maybe it's approved in another country and you can travel abroad. So I don't, it is completely impossible to justify spending a second on a treatment that's not like robustly based on science, because there are so many. And okay, you may say, well, 20% of cancers are rare cancers. So 20% of all cancer patients have rare cancers because there are so many kinds of cancers. If you have a rare cancer and there is only one or two approved treatments, I would still say it's best to try and find maybe a treatment for another cancer where there's some reason to believe it would work for you because of a same genetic mutation, for example, or there are these so-called cancer agnostic treatments that, like some of those local treatments like radiofrequency ablation or some of the radiotherapies, where it seems to benefit a very wide range of cancers. So for the Eleanor's second question, how do you persuade a newly diagnosed patient to explore outside of standard care? I'm always very careful with this kind of thing because I don't give medical advice. I'm always asked for medical advice and I always say I can't give medical advice, I'm not a doctor. And it's not just me being lazy, it's because I see a lot of patients and patient advocates online giving medical advice, and they're often wrong because they don't have the grounding in medicine. They just don't have the depth and breadth of knowledge to better make a useful comment. So I see, in a bunch of the Facebook groups I'm in, I see people commenting on tumor marker levels or types of combination treatments, and they're often wrong. However, I do unreservedly say that you should get advanced treatment as soon as possible, and by advanced treatment I mean the newest treatments, possibly not approved yet, because I think if you have early stage cancer and you're able to treat it successfully, then maybe it makes sense to just stick with the standard care, although I'd still say add on some extra testing, do your liquid biopsies or whatever. If you're maybe you have early stage cancer and it's treated successfully and you're told that you should have a CT scan every 3 months, I'd say do a PET scan sometimes as well, because it may show up something the CT scan doesn't show. But many early stage cancers progress to late stage cancers, unfortunately, and of course many patients are diagnosed with late stage cancer, like I was. I wasn't like diagnosed when the cancer was small and in one place, and when my cancer was found in 2016, it was already spread over a big area. So for late stage patients, I'd say it's absolutely essential, if you're serious about living a long time, to get access to newer treatments or just different treatments or different combinations of treatments. Because for late stage cancer, standard care, or standard of care as it's correctly called for some reason, doesn't have a happy ending. It doesn't result in you being cancer free and living a long and happy life. It may help you live quite a while, but it absolutely makes sense, I'd say, to look where late stage cancer treatment ends. You'll notice it's not a very nice place, and it therefore makes sense to access those advanced treatments. So treatments that are maybe have just been approved in another country, or where trials are just happening and the results have been good, or there's some kind of known mechanism that says why, explains why the treatment should be particularly relevant. So thank you, Eleanor, for those great questions. My friend Kirsten has given me like 6 topics to talk about, so I'll probably just choose a couple in this video. So the first one, topic of talking to children about cancer. So I have 2 children. My son is 15, my daughter is 10. So when I was diagnosed with terminal cancer, my daughter's 2. So she's only known me as someone dying of cancer. And with my son, he's gone through sort of formative years knowing that I have terminal cancer. I find it very difficult to talk to my kids about the cancer, although I do all the time. I find it difficult in terms of it being successful. It's very difficult for children to understand time in the way that adults, or I wouldn't say understand it, perceive it. If a child is 10 and a year passes, they're now 11, they've just had like an extra 10% of their life. Whereas an adult, you may have added 2.5% or something, or so just the concept of a year is very different for a child and for an adult. So it's incredibly difficult. I think I try and be as open and clear with my kids about what's happening, what I'm trying to do. Try and explain that I want to live basically for them more than any other reason, and that's why I can't be with them as much as I'd like, because I'm at hospital, or I'm taking treatments that make me feel very ill, or at the moment I'm not having treatment, but I'm in a great deal of pain 24 hours a day because of a tumor in my liver pushing on some nerves. I'm drugged up on opioid painkiller that also has a bunch of side effects, and I can't sleep at the moment. And so yeah, I'm very limited in what I can do with my kids at the moment. I would say there's a useful guide that you can get for free from the Macmillan website. I think it's called Talking to Teenagers and Children About Cancer. That's really useful. I can't begin to imagine what it's like to talk to a child about their cancer. So yeah, I just cannot imagine that kind of challenge. But maybe I'll do an interview with people with first-hand knowledge of that at some point, and share some ideas with you. Next question, or next topic from Kirsten, about social media, how the cancer world has benefited and suffered from it. So I should obviously start by saying I'm alive and doing this video only because of social media. Without particularly Facebook and YouTube, and to some extent even Twitter, yeah, I wouldn't be alive, because yeah, the social media is the way that I have, well, one thing is it's the way that I've managed to get donations through crowdfunding, which, is paid for all the incredible cancer treatment I've had. But also I've got a huge amount of information from other patients who I've connected to on social media. So that's a massive benefit. The kind of the practical side, and then the emotional side again. I've got to know so many incredible people through social media, and that's been fantastic. And you get so much emotional support from a cancer patient, because you have such an instant bond with them, so many shared experiences, even if they have a completely different type of cancer to you. Maybe you've both done surgeries and chemos, and you've both seen your appearance completely change as you get terrible skin damage, or you lose your hair, or whatever. So that's a huge plus. Generally, I think social media is terrible. I think in the future we'll look back on the big tech companies in the way that we now look at the behavior of tobacco companies, when they knew the connection between tobacco and lung cancer and throat cancer and mouth cancer and other diseases, and they sort of hid it, hushed it up, or whatever. And we'll probably think the same about big food companies as well in the future. So the negative points, so a really big one that I think a lot of people don't really notice is that I think we do know that social media kind of pipes negative information into your brain all day, and that's very unhealthy. And regarding cancer, so I was diagnosed with terminal cancer in 2016, and I joined various Facebook groups and for cancer patients, and got and still do get a lot of benefit from that. But in 2016, the vast majority of Facebook users were under the age of 50, right? It's changed slightly, but it still skews to below 50 or 60. So that means you get a completely false impression about the number of young people with cancer. Completely false. Now, as far as I can tell from the stats, there are certainly more young people being diagnosed with cancer, and some of that seems to be to do with more young people getting cancer, although it's still the smaller part of that increase. The main part of that increase is more detection. So yeah, clearly there's an issue with young people and getting cancer, and I was 36 when I got found the cancer. But it gives you social media gives you a completely skewed viewpoint that like all these young people are getting cancer, and it's of course terrible for anyone to get cancer. I think it's particularly terrible for young people to get cancer. I think it's particularly bad for people in like 20s and 30s, because with a lot of cancer, if you get it when you're much younger, the survival rates are pretty good, and then there's this time when they're not, when you're a bit older. Yeah, so that's one negative thing. Another obvious negative thing is there's so much false information out there about cancer. Some of it is put out by scammers trying to sell you cannabis oil or tea or just a whole bunch of stuff. Some of it's just put out by idiots. Some of it's put out by people with an agenda. Some of it's put out by, good-natured, well-meaning people who are just wrong, and don't understand. They don't understand about confirmation bias and availability bias and survivor bias. So yeah, there's a lot of very, very, very false information out there, and that's massively damaging. And I've seen people die as a result of that false information. Absolutely, there are some cases I could say over the years where people have like tried weird and wacky fake cures for cancer, and the cancer has progressed and progressed and progressed, and then they've sort of messaged me and said, "Oh, can I come to Japan and get immunotherapy?" It's like I try and help those people out, but generally it's far too late. So yeah, there's some bad points. So Kirsten has another 4 really, really good topics which I'll go into in other videos. My dear friend Sarah, how do you manage your life while so sick? It's very sweet of Sarah to believe I manage my life. I do not manage my life, particularly at the moment. Now in the past, I was not so sick. I wasn't well, but I had various toxic treatments and they made me feel weak and ill or whatever, but I could do things to kind of manage them to some extent, and I got quite good at being active and productive when I was feeling okay. Although it does, it puts a lot of pressure on those few days when you're feeling well, if you're going to be very ill after the next chemo treatment, for example. So one thing is, I am a huge believer in paper-based systems. So, I will do things like use these, one page for 1 month planners. So I get all my medical appointments on there. I'm getting better at taking notes and things. So, I have a daily logbook for blood pressure, temperature, and I keep an eye on my weight to make sure I'm not losing too much weight, although at the moment I am actually, which is a little bit scary. Although, I should qualify that and say I'm losing weight because I'm not eating, because I'm on this like painkiller that's a bit like kind of morphine, it's like an opioid painkiller, and it causes appetite suppression, and it's as well, and I can't sleep. So I don't think I'm suffering from cancer starvation yet, but it still is a bit scary to be, losing a kilogram a week or something. Yeah, so managing life, I try and I try and keep stuff organized. I have everything in folders. I take lots of notes. I do try and write a diary, although often, I fail at that. I have a log in my phone that's basically everything I eat and every medicine I take and the time. So that means, there's always, if I'm in a medical appointment and the oncologist says, when did you last eat or when did you last take a certain drug, I've got that there, which is really, really important, particularly when something's wrong. And then I'll do things like when I'm going to meet up with people, I try to meet up with several people at once, because, well, that way, one thing, if I'm sick at the last moment and have to cancel, at least they can meet together and I haven't wasted their time so much. But also for me, I mean, sometimes if I arrange to do something with someone and they cancel at the last minute, that's a really big deal for me if that was my one day of the week or even the month where I was kind of between treatments and feeling okay. So I do stuff like that. I do make a lot of use of tech and online stuff as well that helps me manage a bit. But the honest answer, Sarah, is I do not manage my life well at all. Okay, another kind of similar question from my friend Warren. He says, I miss planning long-term things. How do you personally cope with that? Again, the short answer is I do not cope very well with that. I absolutely have to have long-term plans and medium plans. And that's a big problem with me with the cancer treatment, particularly with my immunotherapist, because my immunotherapist has had decades of experience of treating cancer. He's an immunotherapist and also an oncologist. And the norm for him is that stuff will be planned and then will not work out. Cancer patients will plan to do a certain series of treatments, and after the first one, something will be wrong and they can't proceed on to the next one. That's just the norm. But for me, I have to make some plans. So what I try and do is have contingency plans, try and work on several things at once. And I'm kind of getting a bit better at sort of not being so upset when my plans are destroyed by cancer. So up until 6 weeks ago or something, 6 or 7 weeks ago, things were going really, really well. I was making huge progress with my non-profit organization. And suddenly everything was wiped out by, some new cancer growth and cancer spread. And then so I had a couple of weeks where I was trying to get back up things under control, and then things got considerably worse when this new tumor in my liver started pushing on some nerves, and I'm now in pain 24 hours a day, and taking a heroin-like drug and all this kind of stuff. And, so sorry, Warren, not a very good answer, but what I do is I just keep planning long-term stuff, and I think in some of my early videos I talked about this thing I'd heard of, the difference between optimism and hope. So optimism is the belief that things will get better, and I'm not an optimistic person. But hope is the knowledge that it's still worth fighting, that you can still potentially turn things around. And in 8 years of being deeply embedded in the cancer world, I've seen people turn stuff around in the most impossible situations. So yeah, hopeful but not optimistic. Yeah, so Lame says, are there any supplements or repurposed drugs that you think are helpful? I basically avoid supplements. I mean, they get talked about a lot in various online forums and stuff. But whenever I do occasionally like dig into it, there's just nothing there. I'm pretty confident of that, actually. And the reasons for that are a bit complex and complicated. It's partly to do with what people think they're taking often isn't what they're taking. A lot of supplements are what are called white label products. So a company, usually a big pharmaceutical company, will make a supplement, and then it will get they'll sell it as a generic wholesale thing, and then a sweet family-run business will buy it in bulk and stick their labels on. And yeah, quality control is poor, and yeah, I mean how stuff gets metabolized in your body is an incredibly complex thing, and typically if you're taking a bunch of stuff, some of it's just going to go straight through you. Yeah, you'd need to talk to probably a hematologist about how all that works. But yeah, so supplements, never seen anything there. Repurposed drugs. So repurposed drugs, that's when a drug is approved for something and then seems to have a benefit for something else. And there's some very, very famous examples of this, like aspirin, which is sort of a painkiller or to bring down a fever. And the side effect of aspirin, or a side effect, is it thins your blood, which means it's potentially very useful for people with risk of heart attacks or whatever. Viagra, which was a high blood pressure medicine, or and also a angina medicine, now used, for something very different. Metformin. So metformin is one I actually take as a repurposed drug. I take it because possibly it helps with cancer a bit. The evidence for it is a lot of studies have found it's helpful. However, those studies are not particularly good, and it seems to have such a tiny benefit. However, yeah, I don't get any side effects from metformin. It's it's old, it's safe, it's easy. You can buy it online cheaply, although I wouldn't. Yeah. So if you do take repurposed drugs, please get them from a pharmacist, and you have to find a doctor who can legally prescribe them for you. But I wouldn't. You don't want to be buying something online and you're getting repackaged caffeine tablets or worse. Be it repurposed drugs, it's a really tricky area, because a lot of the people who talk enthusiastically about repurposed drugs online, they do not know what they are talking about. They do not know what they're talking about. They're mixing up animal studies with human studies. They're mixing up cause and correlation. They're getting confused about subgroup analysis, which is like where you have a trial and a little group of patients in the trial seemed to get an unusually good result. Well, that indicates something you might want to research, but it's not evidence that it works because you weren't randomizing for that factor. So metformin, for example, it was found that for some trials of some cancer drug, the patients with diabetes who were taking metformin seemed to do slightly better. Well, that's not evidence, but it seemed to be worth looking into, and a bunch of people looked into it, and it seems that metformin may be useful. So yeah, I am skeptical about repurposed drugs. The idea is very, very good. I think as patients, we often we don't really understand drug development enough and drug approval. So I remember thinking like, well, look, there are all these drugs that have already been proven safe and seem to have a benefit for cancer. It must be easy to just, it's safe, so you can do a trial quite easily, and it could be of great benefit to cancer patients. That's not true at all, because a safety trial, that's your phase 1 trial, that's the small, cheap, easy thing. The big thing is the 3 or 5 year, massive follow-up trials, the phase 3 stuff where you have to prove it actually works. And typically you need to prove it works better than standard care. So I'm just going to do one more question for this video. So my friend Angie has 8 questions. So yeah, I'll just do a couple of those, or one of those. When you've given talks to medical students about your experience of cancer treatment, is there anything that seems to shock them? They tend to be shocked at how much treatment I've had. They are often shocked by the side effects. When I explain just how toxic these drugs are, and how as a cancer patient you may be taking drugs not for a couple of weeks like an antibiotic, but months, years. You may have a bunch of treatments at once. Yeah, the medical students are definitely shocked when they'll say, like, they might ask like, oh, have you ever suffered from X? And I say, well, yeah, I have suffered from that for almost every day for 8 years. So they're kind of shocked by that. They're often shocked by the life expectancy of late-stage patients. When you say to them like, oh, well, when I was diagnosed in 2016, because of the where my cancer had spread to and the amount that it had spread, life expectancy was just 7 to 9 months. And they're like, wow, that doesn't seem very long. Because of, they're medical students, so they're like in 19, 20 years old. So the next question from Angie, likewise, have there been medical staff who have opened your eyes to something or surprised you in some way? No, not really. I guess one big thing was just a piece of advice that I got from a GI oncologist early on at the immunotherapy clinic, and she just said to me, you should take advantage of the skill and expertise and facilities of the big hospitals, but take advantage of the connections of the clinics. So in Japan, there are obviously lots of hospitals. In Tokyo, we have 400 hospitals, but we also have loads and loads of clinics. Some clinics are run by, people who worked for, I guess, a few years in a hospital and then worked in, now work in a clinic or set up their own clinic. But there are plenty of clinics where they're set up by doctors who did 10 or 20 years in a big hospital, and they're connected to so many other medical experts. And just having those connections has just enabled me to meet specialists who generally it would have been much harder to meet or whatever. But taking a question in a negative form, Angie, about medical staff who have surprised me in some way, I am still continually surprised by how narrow their knowledge is, or how they misunderstand other people's treatments. So typically, for example, a typical oncologist knows quite a bit about chemotherapy, and a bit about other stuff. But yeah, every specialist thinks their treatment is the best, and they often have really false ideas about other people's treatments. And I mean, one of the big factors I'm alive is immunotherapy, and most oncologists have completely the wrong idea about immunotherapy. They think it's like a single treatment, that it's just one thing, namely checkpoint inhibitors. But they couldn't be more wrong. I mean, immunotherapy is a branch of oncology, and there's wide range of immunotherapies, and some have been used for many years, and have very, very robust evidence that they work. So I will do more Q&A videos soon. Please hit the subscribe button so that you see when the next videos are, and also that helps my videos get to more people on YouTube. And as always, thank you so much for your interest, and I hope this has been interesting and or useful. Thanks a lot.